Welcome back, everyone. We're now on to session 3 for the Health Facilities Design and Development Victoria online event. And leading this session today is Mark Williams, the Managing Director of TRIXi Building Insights. Mark will be sharing with us how his team partnered with Melbourne Health to modernize asset services, improve staff productivity, and increase value generation at the health services infrastructure, value generation from the health services infrastructure assets. Once again, questions. Please ask Mark as many queries as you have along the way in the Q&A box on your screen, and we'll get to them at the end of Mark's talk. That said, Mark, please take it away.
Thanks, Vish. Hi all, Mark Williams from TRIXi. Trust you've been enjoying these virtual sessions, and thank you for attending this one. Hope you find it at least a little interesting. So I've been delivering technology solutions for over 30 years now, and today I'm going to share with you some information about a project that I'm most proud of. Unfortunately, we've only got half an hour or so, so it's going to be a pretty rapid overview. Of course, if you're keen to know more, just let me know in the chat, as we said, or via email afterwards, and happy to catch up at your convenience. So the intention is to take you through Melbourne Health's experience in implementing their computer-aided facilities management solution using IBM TRIRIGA. We'll look at the Melbourne Health experience and then a bit of an overview about the functionality that it provides. And time permitting, I'll give you a quick demo of the technology at the end. So let's kick off with a quick video about Melbourne Health. Kind of cringe at the sound of my own voice, but it was advised that it's a decent introduction, and we should roll with it. So your building can really speak to the clients and tell them how it's performing. It can use sensors and IoT to let you know if some of your assets require maintenance based on their condition. And the way this all happens is through the integration of people and sensors and systems. And the system that we're talking about is IBM TRIRIGA, which is what we specialise in. On Melbourne Health, the solution supports 10,000 staff, so clinicians, facilities management people, and in fact all of the staff can raise service requests and interact with the system. While they're not geographically dispersed, they've still got 33 sites and 70 odd buildings, and in the past doing that on half a dozen disparate siloed systems and paper-based systems. So coming to TRIRIGA has totally transformed the way they manage all of their facilities. Pretty stunning number of service requests. I think there's about 400,000 in the last 8 months that they've raised, so they're certainly utilising the system and continuing to grow and expand it through other areas of the business. One of the neatest bits that they've done is using a spatial, a CAD-based interface to the system. So when they need to know the location of a ward or of an asset, they can do that by clicking on the CAD drawing. There are already examples of them using AI and IoT, but we're going to increase the use of that sort of technology through the hospital. We implemented this on budget, and interestingly, we actually delivered it before schedule. We were confronted with COVID-19 just as we were supposed to implement, and it was decided by the steering group that we should implement early because they really needed the benefits coming from TRIRIGA during the peak of the pandemic. Enabling people to understand how many cleans they do, how many discharges they do, how many patient transports. They didn't have this data at their fingertips before, and now they have this information. They can be better resourced and better funded in the work that they do. So that's a quick overview. Let's explore a little more. CAFM TRIRIGA is much more than an asset information management system, or AIMS. It provides Melbourne Health with a platform to provide are really quite comprehensive facility services enabled by some pretty cool technology. That said, the AIMS is still really central to the platform, managing centralised asset information in line with AMAF. Around the central asset register and shared portfolio data, IBM TRIRIGA provides a suite of additional functionality, including things like operation and maintenance of those assets, strategic facility planning around the whole portfolio, management of spaces and real estate, as well as capital project management. The other one there is environmental performance management. So with environmental performance, think things like analysing the performance of your facility through the data that you get in through utility bills for energy waste, water and emissions. The centralised portfolio of data is much more than just an asset register. Portfolio data is shared across all of the IBM TRIRIGA platform. We call it people, places and things. The things typically being assets. The places can be locations, addresses, geographies, and the people can be individuals, internal, external, groups of individuals and organisations. On this slide, you can see some of the stats around Melbourne Health portfolio data in this slide. IBM TRIRIGA has been set up to support 387 different types of service requests and work tasks. Another key feature is the CAD plans that have been uploaded that are used to provide smart interactive maps of their facilities. Okay, great. So, Melbourne Health have implemented a solution that ticks the AIMS part of AMAF, but the business case identified a whole slew of other direct and indirect benefits. So let's look at some of those. It's not too difficult to improve service delivery from a point where you have paper-based or multiple siloed systems. So they've done that. Great. They're now managing assets in a way, in a more mature way, moving to asset optimization rather than just keeping the lights on. A big part of this is knowing what assets they have and their condition. One of the most personally rewarding benefits I've seen is the way the mobile experience has really transformed the way many staff work. Transformed in a really positive way, not just for the benefit of management, but for those actually using the system. It's just a more modern and efficient way to work. The staff have really embraced it. So with core facilities management, asset management in hand, it allows facilities management to take a more strategic look at the performance of facilities and specific assets. This analysis has really improved through the reporting capabilities that came with the solution. So that's just a snippet of some of the benefits already realised. After the initial implementation, Melbourne Health have moved into a more agile service delivery model where new organisational units have been brought on board and additional TRIRIGA functionality is rolled out. So, for example, radiology have come on board, a number of different groups. Melbourne Health is still continuing to push process automation as much as possible to free people up to look at higher order insights. As an example, as part of the initial implementation, IBM TRIRIGA was integrated to FMIS, the shared service for Oracle Financials. I think most of the districts are on the same shared service for Oracle Financials, but not all at the moment. But anyway, this integration is automated, so the systems are synchronized at all time, giving you a financial view of how your facilities are performing. Another example of automation is using Internet of Things sensors on bathroom facilities to automate the generation of cleaning tasks based on actual traffic rather than a predefined schedule, as is traditionally done. the same sort of concept with IoT is used for condition-based maintenance of key facility assets. So key to the transformation is actually a pretty simple thing, knowing what you have and what you do allows you to optimise its management. Melbourne Health now have access to information and insights that were not possible before IBM TRIRIGA because they couldn't easily access the data, or it wasn't granular enough or organised in the right way. Now they know what they have, they know what they do, and they can more easily justify budgetary requirements. So as an example, this slide shows a breakdown of delivery and collection service requests that just come straight out of a report out of the system. The photos on this slide are from May last year. So while the comment here is very true, underneath happy users, if you deliver intuitive software, the software will be used. Credit must also go to the CAFM team who manage the change readiness really well. I've seen the best of technology solutions fail because people didn't understand the whole, what's in it for me paradigm. But the CAFM team at Melbourne Health managed this really, really well, and as a result, we've got a user base that have truly embraced the solution. So since then, we've moved on from just happy users showing us their mobile applications to empowered users who want more and more, more functionality and the ability to optimize their operations. The photo on this slide is of the legend that is Dobbs, a terrific operator who embraced the solution. You can see here his central control panel where he can see the progress of work tasks in real time on a spatial dashboard. While it's very true that the mobile interfaces are pretty intuitive, I don't think that's what Dobbs was saying when I took this photo. Luckily, it was more like, hey, Mark, when are you delivering that one-click enhancement for me? But anyway, a good example of how they're using the technology now. So what does IBM TRIRIGA do and what does it look like? Well, let's just whet the appetite with a couple of screenshots, but time permitting, I do have a quick demo to show you. The key point here is that TRIRIGA looks and behaves very differently depending upon your job role. It's not like a Microsoft Word that's just got a standard interface. It morphs and changes depending upon what you do to suit the role and the process that you're doing. So it may look, TRIRIGA may look like this if you're a work supervisor and focused on work planning and tasks and managing the performance of a team. Or it may look like this if you're a facilities manager, kind of looking at a more portfolio view of the performance of your facilities. Or it could look like this if you're more focused on space management. Here is a couple of screenshots of the Workplace Services app that's available to all the 10,000 plus Melbourne Health staff. Or it could look like this if I were managing work tasks in the field. So look, that's just to whet the appetite. As I said before, I'll do a quick demo, time permitting. But before I do, let's look a little closer at the breadth of TRIRIGA and why you would look at such a system. So, well, we all know that healthcare managers are facing significant challenges when it comes to managing their facilities. Ventilation systems are in laser focus. The cost of managing facilities is outstripping budgets with a growing deferred maintenance. I'm sure it resonates with a lot of you. So keeping on top of it means meeting AMAF compliance, having costs and forecasts at your fingertips, and knowing the condition of assets so you're not wasting money on unnecessary maintenance. On top of that, a single large facility project exceeding budget, which they often do, can really impinge on efficient operations of your facilities. IoT, sensors, building management systems, BAS, all represent enabling technology that will help your assets speak to you. But the challenge is turning all that data into simple insights that you can act on. The icing on the challenge cake here is that we really have a responsibility to ensure the occupants of our facilities are safe and satisfied with their workplace experience. I've got some stats in there that are relevant. There's sources there, but I struggled to find any metrics pointing to poor workplace experience in Victorian healthcare. They were all actually really high. The one I did find, understandably, patients surveyed at a fracture clinic may not be the ideal survey candidate. Still, my experience with Melbourne Health shows that many healthcare professionals weren't aware of how this sort of technology deployed via mobile devices could really improve their workplace experience. An example, discharge surveys at Melbourne Health showed about 75% of patients are satisfied with the discharge arrangements. Obviously that's not all about, technology solutions, but some of this experience can be streamlined using IBM TRIRIGA, and the results are improving for Melbourne Health. So yet more challenges. This is just some of them that have been relayed to me by facilities managers. I'm sure you could add many, many more to the list. I think having the information and time to justify a workable budget is a massive challenge. And I'm sure a lot of you on this session are feeling that. There still seems to be a bit of a barrier to easily translating facilities data into financial terms. Not just our buildings are aging, which they are, but our super experienced facilities management staff are also aging, and we need to digitise all of that information, all of that knowledge about your assets and all of their experience. So I think that's another key challenge. The other thing, the need to improve workplace experience for staff and patients is not going away. I made a big point of in the previous slide, but it's clearly in the remit of facilities managers. So look, while there's a growing list of challenges, and we could add lots more, there's also some fantastic opportunities to apply technology to help with some of these challenges. Melbourne Health developed a really comprehensive business case that was reviewed and endorsed by Deloitte. They've met and in some cases realised greater benefits than expected. So a key message there. And, the Internet of Things and artificial intelligence will continue to revolutionise facilities management in healthcare. So from real estate and who else? Space strategists to facilities and maintenance operations, there's kind of limitless use cases to develop outstanding workplace experiences and to reduce costs through greater efficiency. To pick just a couple of things on this slide, I expect indoor navigation to massively improve workplace experience in the coming years. Imagine having the outdoor blue dot experience that you're used to with, a Google Maps, Apple Maps type experience, for that to work seamlessly indoors, giving you wayfinding directions as you walk around a hospital. How about seeing exactly where your expensive mobile assets are in real time on a map of your facilities? That's possible now with the technology in TRIRIGA. Asset monitoring with sensors will improve the reliability and better target maintenance spend. Occupant well-being is paramount. I've kind of harped on a little bit about it, but the actual environment is pretty easily monitored using inexpensive sensors. Buildings are rapidly undergoing instrumentation. You may not be aware of all of it, but some of it you can see. So, for example, when you badge in, when you badge out, that kind of usage data. When your devices are using Wi-Fi, that Wi-Fi data and IoT sensors, embedded sensors are everywhere and generating streams of data that are transforming the user experience in buildings and are driving cost out of maintenance operations. As we add more AI and advanced analytics to this information, we can make better decisions around space and occupancy, managing buildings, site selection for future operations, and enhancing the workplace experience for staff and patients. Okay, so let's look at some of the functionality provided by TRIRIGA. TRIRIGA provides a really comprehensive solution for managing the operations and maintenance of your assets. Core to that is managing service requests and the resulting corrective or preventative maintenance work tasks. TRIRIGA provides a full contact center capability as well as the self-service mobile application. Getting this function working well will reduce your total cost of ownership and improve the workplace experience. The TRIRIGA Capital Projects module can help you advance the quality of capital projects, facility projects, environmental projects. You can use advanced collaborative project management capabilities and project planning to help you identify project risks and benefits so you can drive on time, on budget projects. So while TRIRIGA Project supports detailed activity management, it integrates with Microsoft Project and Primavera to bring those activities in if you want to. Its real forte, though, is not in that low-level activity management. Its real forte is in managing the funding sources and the approval of those funding sources, and then providing a whole project portfolio dashboard of all of the facilities projects that you have. With the TRIRIGA facilities module, you can balance right-sizing, moves, consolidation, and occupant experience, so you can use the facilities to their fullest. You can use AI-driven insights to ensure your space planning meets demand with real-time occupancy monitoring. You can also make strategic space planning easier with self-service options, automated mobile processes, facilities management, and space reservations. Not just spaces, but in fact, any asset can be reserved. For example, vehicles and buildings as an example. So, car parks, that sort of thing. You can reserve. You can make any asset within any asset or space within TRIRIGA reservable. So TRIRIGA supports geographic information systems, GIS, CAD, and BIM, BIM's building information modelling. So the BIM can provide you with an accurate, as-built digital twin of your facilities, so you can view it and spin it in 3 dimensions, and it's a digital twin of your facilities. So it's not just useful for the whiz-bang 3D visualization, but actually comes in really handy for maintenance operations. So when someone's on site, they can see where the control panels are and where certain assets are that may not be immediately visible to them. It also automates getting quality data into TRIRIGA. Melbourne Health use their CAD drawings to automatically generate the buildings, floors, and spaces within TRIRIGA. BIM will also create the assets and associations between the spaces and assets, so it goes a step further than just the CAD drawings. The TRIRIGA Trees module, we call it Trees, TRIRIGA, Real Estate, Environmental Sustainability, allows you to track your use of energy, of water, of waste, emissions. It's got all the emissions factors built in, it's updated. It provides a framework for managing environmental opportunities to improve the performance of your buildings. So, you know, it's set up to do all your CO2 footprint. Not all of our customers use that. Most of them use it just for monitoring and analysing the performance of their facilities from an energy efficiency point of view. So the key to making trees really hum is getting flows of data coming in that can be turned into insights. Most often we get this data in the form of utility bills, but also building automation systems and sensors. So lastly, the TRIRIGA real estate module is pretty widely used actually, even just as a standalone module. It manages all sorts of real estate transactions and is terrific at managing leases, either as a lessor or a lessee. And it has all sorts of relationships between leases and subleases that makes it pretty flexible. It's used by the big banks and telcos as their lease accounting solution. It's IFRS AASB 16 compliant and is used by Deloitte's, KPMG's, and that sort of thing. So, okay, so that's that's TRIRIGA in a nutshell, a kind of 2-minute overview. So I think we've got enough time to just have a quick demo and then Q&A. Okay, so here I'm going to just go through a pretty simple use case. I'm going to create a service request, maybe a reservation, and we'll just follow that through a pretty simple workflow. So here I'm logging in as an employee, and this is the standard user interface. It defaults to where my GPS location is, or my, as a person, my default location. So here I can look at my reservations, I can look at any service requests that I've raised and see the progress of those service requests in real time. So let's do a quick reservation. We'll just do a simple one here, maybe of reserving a meeting room. So we can also do workspaces if you need a personal workspace, or car parks, that sort of thing. So we've added a few people and we've just done a search here. Comes back with a list of the rooms. You can view the rooms as a list, or you can view them via the CAD drawing on a floor plan. Then what we can do is let's just select a room that's available. So we'll select that. You can see I can update some of the information. My hold expires in about half an hour. Let's add some catering to the meeting. We could add some equipment as well. And equipment can be any asset that's reservable, that's associated with this space. So we'll say, let's have a projector, thanks. Okay, so that should be it. Oops, it told me that I forgot to actually add in a subject. So let's put in CAFM meeting. Okay, done. So that's my reservation done and approved. Let's scroll down, and yep, there's my CAFM meeting. So now let's make a service request. We're in our office space here, and we've noticed that it's a bit cool. So this can be any issue with the facilities. In this case, I'm just going for a HVAC issue. It's freezing in here. You can add comments and photos. You can locate things using a barcode scanner to locate where you are, or to identify a specific asset that you have a problem with. So there's my meeting and there's my service request. Let's now log in as a supervisor who can manually assign work tasks. You can set it up in TRIRIGA so that some sorts of work tasks are automatically routed to specific contractors or people. In this case, we're looking at you can divide things up into different work groups. So let's go back to maintenance services. You can look at unassigned, assigned or overdue. So let's just simply drag. You can do one at a time, or you can select multiple work tasks and drag them to a resource. Let's drag a couple over to Ben working, and that's basically it. So we could log out here. Actually, let's just have a quick look at Ben's schedule, so you can easily just click on a resource in your team and see what they're working on. Okay, so I've now allocated that out to the field. So now let's log in as Ben. Okay, so this is the user interface for work task management. You can see here a list of my jobs. You can find them by asset. You can filter them by corrective maintenance or preventative maintenance. You can sort them by priority, or perhaps by let's do the newest first. There's a list of jobs. You could identify them by task or asset or location, so you could pick up all the tasks for a particular location if you want. You can see them in different states, so if they're in progress, completed, draft, if they're unassigned. So let's choose a task. Okay, so we've chosen a task here. We can override the priority. Most people, when they create a service request, will think that it's always high. So we'll create this, we'll have a look at the service request. I can look at how many requests, because you may have multiple requests that are associated with one work task. We can have a look at the locations. We can have a look at the associated assets, if there's any safety procedures that apply. All the photos and documentation and warranty documents are there. So I've just clicked on the timer to start the job. Let's look at where we're going. So we need to go to the police room. There you can see it's highlighted on the map. You can actually get directions to that location as well. Okay, let's stop the timer. And we've now finished the job. Let's put in a resolution summary. And that's it. So simple as that. We've just gone through a whole process of service request right through to completing that job. While I'm here, I might as well look at what's unassigned. So as I said before, things can be automatically assigned by the system based on the service request type. They can be assigned by a supervisor, or in some cases you may want to have a group that has a pool of tasks, and the actual resource can control what they're doing. So you can all set that up through configuration. That works offline as well, the form. So I hope that demonstration made sense. Sorry, it was all very, very rapid. Open it up now to any questions.
Thank you for that, Mark. That was a very insightful presentation, and the fact that you could actually take us through a case study to show what asset management can actually do if you went down the digital transformation and the data analytics journey was very interesting. And we are a bit over time, but I do think we can take a couple of questions before we head on to the next session. The first one being from Rachel Thomas from Melbourne Health. I'm going to push the question over to the slide area. So the question is around how much time did it take from engagement to implementation when it came to the project you did with Melbourne Health?
Okay, great question. I won't indicate how long the pre-sales was, because it was a number of years and a long journey. So from when did we start? So it was just over 16 months, I think, from the initial inception. We went through a proof of concept at first, but yeah, just over 16 months. So it wasn't a short thing. We can stand things up pretty quickly, but often, the change management that I highlighted before, that needs to be done properly. So it's not so much the length of a project isn't so much based on what the technology, how quickly the technology can be developed. It's more about how quickly the business can adapt to the change. So that was the real critical part.
Okay, sure. And look, one last question. We do have tons of questions here, but we have time just for one more, and I'm sure you can address the remaining questions offline rather.
Yep.
So I'm going to push this one to the slide area. This is a question from Sachin Beher, who is from Philips Electronics Singapore. He's asking us to tell him a little bit more about the change management process. How did you help the users embrace your smart solutions?
Yep. So I could go on about this for hours. We haven't got the time today. But look, key to it is engaging users early. So, making them part of the discovery sessions so they understand the journey that you're going on, rather than saying, here's a system and adapt to it. So early engagement is key, and having someone actually dedicated to that task. Typically in technology programs, it's all about the technology and getting it implemented, but change, as I said before, is just as important. So sorry, that's not a very comprehensive answer, but happy to follow up and discuss it afterwards.
Okay, beautiful. Look, thank you for your time today, Mark, once again, and thank you for the attendees for tuning in. We'll be kicking off the last session at 11:45, so please do join me for that one. That one is a panel discussion with leaders from Bendigo Health and Albury Wodonga Health. So yeah, see you on the next one.
Thank you.